Hi, my name is Alexa Roy, and I'm a second-year Master of Public Health student presenting for the Western Regional Public Health Training Center on my MPH internship. My internship site for my Master of Public Health internship is with the End of Life Care Partnership, otherwise known as EOLCP, anchored at United Way of Tucson in Southern Arizona. And my internship was from May of 2020 to February of 2021. And the purpose of the EOLCP is to change the way society talks about death. My preceptors were Dr. Alicia Ramirez Hall and Dr. Beth Meyerson. The goals of my internship were to gain quantitative research experience, to strengthen my writing skills, and increase my knowledge of LGBTQ older adult mental health. My deliverables were a literature review utilizing an Excel spreadsheet, as well as a public-facing summary fact sheet and a research poster. My research project, Aim 1, was to examine whether age intensifies the impact of COVID-19 on LGBTQ populations in a 2-state sample. Aim 2 was to examine whether support reduces reported depression among older adults who are LGBTQ in Arizona. The aim of my literature review was to evaluate and summarize existing literature on LGBTQ older adult mental health and social isolation. The methods for my research project were as follows. For Aim 1, I utilized 2 surveys, one from the University of California and one from CIRO, which stands for the Southwest Institute of Research on Women. And I utilized a college student STEM survey from the University of California from April to May of 2020, and a CIRO cross-sectional survey of older LGBTQ Arizonans, ages 55 years and up, during the Arizona stay-at-home order in April 2020. I matched 22 people from each sample. So I identified 22 LGBTQ college students from the University of Arizona sample and 22 LGBTQ Arizonans from the CIRO sample and matched them on sexual orientation, gender identity, race and ethnicity, and living situation when possible. I utilized an independent sample t-test to analyze whether age, sexual orientation, or living situation made a difference in reported depression among these groups. And Aim 2, I utilized the entire CIRO data set on older LGBTQ Arizonans and a one-way ANOVA test to evaluate the association of different types of social support on the mean depression symptoms reported by study participants. For the deliverable number 2, the literature review, I utilized an Excel spreadsheet and created subcategories utilizing databases such as PubMed, Google Scholar, and PsycInfo to find information on older LGBTQ physical and mental health, living situation and depression, social isolation and support, matching methods, and information about comparing depression scales for research. From this Excel spreadsheet, I summarized the literature into a public-facing summary fact sheet, which I presented to the Southern Arizona Senior Pride Organization. The results of my research project for Aim 1 was that for all LGBTQ persons, young and old, age was associated with rates of unhappiness, while living situation and sexual orientation identity were not during the COVID-19 pandemic. So as you can see in figure 1 and 2, college students had higher rates of unhappiness and depression during April-May 2020. And this was a surprising finding. We actually expected older LGBTQ adults to have higher levels of reported unhappiness and depression during the early stages of the pandemic in April and during the Arizona stay-at-home order. So this was quite surprising. And when we were looking at our surveys, we did acknowledge that the Arizona study of older LGBTQ adults was predominantly white, and they had stable living situations. And for the STEM college students, as we all know, college students are in a transitionary time in their lives. So we hypothesized that this could have impacted our results. So we decided that more information is needed and more research needs to be done to really understand our results compared to larger samples. For Aim 2, we found that older LGBTQ Arizonans who received support from someone they lived with reported fewer symptoms of depression than those who did not receive support from someone they lived with. So just as a reminder, Aim 2 studied only the LGBTQ older adults in Arizona, so not the college students. So for these older LGBTQ adults, support from someone they lived with was really important for their well-being and happiness. For the literature review, I found that older LGBTQ adults experience health disparities compared to their heterosexual counterparts. And this population may also experience resilience and protective factors because of their sexual orientation and gender identity. Here is my deliverable on the quantitative research project I did. This is my research poster. This is my public-facing summary fact sheet presented to the Southern Arizona Senior Pride Organization. And this is titled Mental Health and Social Isolation Among LGBTQ Older Adults, Resources from the Literature. This is page 1, and this is page 2. I'd like to acknowledge the Western Regional Public Health Training Center for funding my research project. The University of California research was supported by National Science Foundation grants. And the Sero study in Arizona was supported in part by the Jack Chalem Fund. Thank you.